Hello, strangers. I'm Amy. I'm an ordinary person living in this world, on this earth, at this time, and I happen to be a mental health therapist. Before we get started, I'd like to remind you that this is not a substitute for professional therapy or psychological advice, but rather a place to gain some information about mental health and the various aspects of it. If you find yourself in a mental health crisis or need to reach out for mental health resources, 988 is the National Mental Health Crisis Hotline here in the United States. It's an easy to remember number that you can call, text, or chat with if you need mental health services, emotional support, or immediate resources in the case of self-harm or suicide. For now, sit back, settle in, and let's talk about mental health. In today's episode, we're going to talk about the types of psychotherapy or talk therapy that are most commonly used when treating post-traumatic stress disorder and complex post-traumatic stress disorder. Psychotherapy or talk therapy is the process by which a trained therapist works with individuals, couples, or groups in order to help them work through and explore emotional, psychological, or behavioral issues. It provides a safe space for people to express their feelings, understand their thoughts, and develop strategies to cope better with themselves, with others, and with life. Psychotherapy aims to improve mental health and overall well-being by really working with people to help them better understand themselves, how they might have been affected by a situation or trauma. It helps them change harmful patterns of thought or behaviors in order to develop a new way of moving forward with healthier coping skills, improved or changed belief systems, aiming to overall raise the quality of one's life. When looking for a psychotherapist or a mental health counselor or a licensed therapist, there's lots of names to identify the same person, the mental health provider. One of the questions you want to ask when looking for a therapist, particularly if the therapist is for trauma, PTSD, or C-PTSD, you want to ask them if they provide trauma-informed care. What is that? Trauma-informed care is an approach of providing services that recognizes the widespread impact of trauma on individuals. It prioritizes creating a safe, supportive, and understanding environment so that you can have an experience where you feel seen, where you feel heard, where you are cared for, where you are considered, so that you have an experience where you can process the traumas that have happened in your life. And it's adjusting how services are delivered in order to avoid any kind of re-traumatizing and to promote healing. A fairly common theoretical approach to treat most mental health conditions is cognitive behavioral therapy, or CBT. The idea behind CBT is that our thoughts influences how we act and how we feel. If we have a negative thought pattern or distorted thinking, it can lead to negative emotions and unhealthy behaviors. Those unhealthy behaviors and negative thought patterns, for many people who are actively living with PTSD and CPTSD, on one hand, the fear of not being safe or not being okay outweighs the awareness of those negative thought patterns or negative behavioral patterns. You're in survival mode a lot of the time. But the quality of life that results from being in survival mode isn't always the life that people want. So with CBT, it can change how we feel and act in a positive way by learning how thought, behavior, and behaviors are intertwined. The therapist will work with you to help you identify your negative thought patterns or your negative belief systems or behavioral patterns so that you can decide for yourself What do you need to adjust or change in order to reach your best and highest, most healed self? A therapist is also going to help you to establish and design ways to implement newer, healthier, more healed ways of thinking and reacting and responding, a new direction in life. Another theoretical approach is called narrative therapy. Now, narrative therapy is a type of psychotherapy that focuses on the stories people tell about their lives. The idea is the way we understand and interpret our history of experience greatly influences how we move forward in the world, how we see ourselves, how we see others, how we see certain situations, how we perceive the world around us. A therapist will help you interpret what experiences happened in your life that you may still be attached to in some way, how those past experiences affected you, and help you learn and interpret how that is all intertwined and how that all affected who you are today. By reshaping and rewriting your stories, you can discover how you can look past your history and through that trauma in a way that best matches who you want to be and how you want to walk through the world. Having a therapist witness your story from a therapeutic approach in a trauma-informed environment helps you to gain control of your life again, to be rid of the things that have often consumed you because of the trauma. You deserve a place to be free from it. And when you find somebody, a therapist, a mental health provider, who can offer that to you, I highly encourage that you consider it. You all deserve to be well. I deserve to be well. We all deserve to be free from the things that hold us down. Another theoretical approach for the treatment of post-traumatic stress disorder and complex post-traumatic stress disorder is EMDR, eye movement desensitization reprocessing, EMDR. Now, EMDR can be used for other things like depression or anxiety, but it is specifically designed for people that have significant trauma. It's a structured approach that involves using bilateral stimulation. The goal of EMDR is to assist the brain with reprocessing traumatic memories so that they are no longer distressing or as charged. It can be integrated into one's overall memory system and belief system that actually recreates another healthier, more healed perspective. EMDR uses a combination of talk therapy and that rhythmic bilateral stimulation, sometimes through tapping like this, vibrations by holding paddles in your hand, eye movement, where they have you move your eyes left to right, or auditory, where you'll hear a sound in each ear. This helps the brain reprocess those traumatic memories so that emotional charge associated with trauma, all the symptoms that we talked about with PTSD and complex PTSD, it helps reduce or eliminate the charge that's often associated with having had trauma in your life. Now, the processing trauma with an EMDR therapist helps people process those distressing memories and experiences by reactivating the brain's natural healing mechanisms, right? We talked about that in the limbic system, how we have an innate fight or flight. When you have trauma, it adjusts that very natural fight or flight response in an exaggerated way. Not exaggerated in that your responses are unworthy or unreasonable, but it's an exaggerated way within your body that cause maladaptive ways of thinking or behaving, thus causing significant emotional and psychological distress. The EMDR helps reduce those symptoms. Now, oftentimes with people who have PTSD or complex PTSD, there are often nightmares, flashbacks, lots of intrusive thinking, anxiety, panic attacks, depression. Through EMDR treatment, the symptoms will actually reduce, if not go away. With EMDR, another targeted aim is to help build new belief systems. An example for somebody who has a lot of trauma might be, I often feel unsafe or I'm powerless. Through EMDR, one can begin to say, I am safe no matter what conditions are around me, and I am powerful, and actually really believe that. Another benefit of EMDR, which is different than more traditional talk therapy, is that EMDR is relatively quick in its design and approach and its implementation. Many people find that EMDR is a pretty quick and effective way to zero in on the negative belief system that's causing disruption and psychological and emotional distress in your life. Some people find that even after a few sessions of EMDR, they find significant relief. So I hope today that you learned a little bit about how to go about maybe accessing psychotherapy as a part of your healing. It's not the only part. It can be one part. It can be the only part. But oftentimes, psychotherapy is in combination with another form of treatment. We talked a little bit about those in the first episode. But I want you to know there is help out there. If you have questions, reach out to somebody and ask them. And thanks for being with me today. I hope you got something out of it. So until next time, hello, strangers. I'm Amy.